Tell me what the medical monopoly is.
Well, the medical monopoly is a dictatorial system that I call a specialty-based pain management system. And there's no competitor. A $1.6 trillion industry. And to put that in perspective, big oil is 100 billion. They're not even in the trillions.
Yeah, right.
So medical has surpassed everything. What I mean by they're specialty based is if you have a knee problem, you come in and you say, "Doc, my knee hurts." He's going to focus right in on that knee. And at some point, you're either going to get drugs or you're going to get cut.
Or injections.
Mm-hmm. There's no other option.
There's none. Sometimes they'll tell you to go to physical therapy.
Physical therapy is part of the medical monopoly.
So you can't win.
Anyone that takes health insurance is the medical monopoly. Even if I was offered health insurance, I would turn it down.
Really?
Yeah, because you don't want to be, as a practice, I don't want the Peace Over Pain Clinic to be involved with that. I want to be independent. Once you start getting involved with that, you might make more money because people can come for 15 bucks, right? I use my mother as an example. You know, she had an eye injury not too long ago. And it was, you know, getting a little blurry and this, that, and the other. She goes to the eye doctor. The eye doctor sends her to the retina doctor. This is what I mean by a specialty base. It's like, is the foot doctor going to send you to the toe doctor? Like, how many doctors do we need? And so the retina doctor diagnosed her with an eye stroke. 70-something-year-old woman. Yeah. Nobody wants to hear the word stroke.
No.
It's scary.
Really scary.
And I say, Mom, it's your shoulders. It's your shoulders. Look, I'll show you. Let's do a wall test. Look at your photos. Look at this. Your shoulders are in like this. Your eyes need a tremendous amount of blood and oxygen. Mm. If your muscles, if your shoulder and neck muscles are all messed up, that's intercepting the flow. And so your eye isn't getting what it needs, and your eye needs a lot. And so people can get vision issues from their shoulders.
And people hearing this might say, that's crazy.
Yeah.
But if you think about it and hunch your shoulders up, you can feel that.
Yeah. And I know this myself because my left eye is worse than my right eye. Mm-hmm. Mm-hmm. And I know that I have a pinched nerve because I get tingles and stuff. So that's something that I myself have been working on for a few months, and it takes the fear away.
Right. It
takes the fear away. So if your eye is messed up, you can say, all right, I got to do my postural therapy, instead of being like, oh my God, I got to go to the doctor.
I need meds.
What is the doctor going to do? Unless you have an actual emergency and you need acute care, they realistically can't do anything. And that's what I'm trying to convey in this book. This is to break somebody's limited beliefs. I'm just telling you flat out.
It is. It is, because in the thought process of when you get the flu and you feel so bad, you feel so bad, you want to go to a doctor to help relieve whatever is making you so sick. And you're just like, give me meds. I just want to feel better.
Right.
That's what a normal American person will do.
Yeah. But I actually call it medical monopoly every time I refer to them.
I know.
Because I want people to get it in their head that you're dealing with a monopoly. And because it's not an actual business like Amazon, it literally has no competition. Amazon has to have competition. If there's no Walmart or Target, then Amazon's a monopoly.
Right.
And that's against the law. But with the medical system, they're completely breaking the law. Kind of. The law is twisted to make it happen.
To keep people in the system.
And Big Pharma, which is part of it, makes a lot of money. And the equipment industry makes a lot of it. They could buy an x-ray machine for, you know, $3 million. And then they run you through it 1 million times and your insurance covers it.
Yeah, they do.
So it's like,
it's all paid for.
That's the thing. Like I was at a party just a few weeks ago, and this older gentleman, his spine is, you know, flexed forward, and he says, "Oh, there's nothing they can do. It's part of." I said, "No, we can correct that." No, my knees, blah blah blah. No, don't you see what you're saying? Your spine is messed up, and your knees. Isn't that suspicious? It's all connected.
Yeah.
And I'm like, you're standing on 80 grand. Those knees put a lot of kids through college.
Yeah.
These surgeons are putting their kids through college off your bad knees.
My knee was probably 100 grand.
But you know what he says to me?
What did he say?
He says, they're going to cover it anyway. You see? It's a monopoly.
It is.
Well, I'm just going to go get knee surgery because it's covered. I don't pay anything. I just pay a little bit.
Have you read Peace Over Pain yet? This short but powerful book reveals how to eliminate chronic pain and or illness faster than any other known therapeutic approach. Download the Peace Over Pain book for only $4.95 and gain instant access to the ebook version, audiobook version, and a video training with Dr. Reese. Go to peaceoverpain.com and start reading or listening right now. This is the information you've been praying for.